joining us for our webinar today. We're going to be talking to you about the intern year experience for our UCLA Neurology residents. I'm a little under the weather, so excuse my hoarseness, but fortunately I won't be doing most of the talking. I'm joined today by our wonderful internal medicine colleagues from the UCLA VA Internal Medicine Program, Dr. Kelley Chuang, and from the Olive UCLA Internal Medicine Program, Dr. Laxmi Suthar. So we'll take each one in turn, and we're also joined today by several of our neurology interns who can tell you more about their experiences at the VA and Olive this year. And then we'll have some time for question and answer at the end of today's webinar. So maybe I'll let Dr. Chuang get started. So we will introduce first the intern year experience based here at the West Los Angeles VA. That's part of our UCLA Neurology categorical residency program. So take it away, Kelley.
Thank you. Welcome everybody. I'm the site director over here at the VA for our in the neurology intern that is based out of our VA. This is a picture from our fall retreat. So you can see we're a pretty big internal medicine program, but we love having our neurology colleagues with us for the year. So our program has 5 pillars here that I'm not going to belabor, but I truly hope that when you join us for your year that we can really instill the sense in you. And we have 6 categorical positions within our program. So that is 6 out of the 9 are in with us at the VA. I think Dr. Keenan will go through the logistics of how to rank it because I know it's a little bit complicated, but we're the neurology categorical option, so the program number ending in C0. And essentially it's a full year of medicine training with us that's integrated with the internal medicine program here at UCLA. You'll be fully based at our VAs, so that's the West Los Angeles VA and Sepulveda VA. You'll spend probably the majority of your time at the West LA VA and maybe 2 weeks out of the year at the Sepulveda VA, which is an outpatient center. So these are our VAs. This is essentially the greater Los Angeles VA encompasses both West LA VA and Sepulveda VAs. This is the West LA VA where I'm currently sitting. This is where you'll do all of your inpatient rotations. It is the largest hospital, or the largest VA in the country. And it's really a very complex center where we take care of a large number of veterans across all of Southern California. And then you might recognize Sepulveda VA where you'll spend some of your outpatient time. This is the external view of Sepulveda VA. The internal view is what's actually used on Grey's Anatomy, so it's known for that. And what I'll say about our VAs is that first, our West LA VA is really on this huge campus in Los Angeles that has a lot of services for our veterans on campus. So in addition to the hospital that's here, up north, we have 2 skilled nursing facilities for our veterans. We also have residential substance use treatment facilities. There's even like a mini golf course for our veterans and a vegetable garden that one of our resident alumni restarted this year. So there's a lot of cool stuff on our campus and a lot of resources for the patients that we serve. And I obviously am biased, but I think our VA is really the best one in the country. You may have one at your medical school, and a lot of people say once you've been to one VA, you've been to all of them. But I think ours is very different in that we are a very big hospital. We're a quaternary care center, and many of the veterans in our region are actually referred to us for subspecialty care. So they'll take a bus for 3 hours just to come to our VA to have their clinic appointment. So in addition to being a large hospital, we have wards, a progressive care unit, which is like our step down unit. We have an ICU, we have an emergency room, and then our primary care clinic is truly a patient-centered medical home. So we have kind of plugged in the same clinic as mental health and social work and a lot of the other resources that our veterans need in the outpatient setting. Our patients are 100% federally insured. So the majority of our patients that we care for are inherently vulnerable. And I will say that while there's a small subset who might have external insurance and who still use the VA for parts of their care, probably close to 100% of the patients we take care of on the inpatient side really can't get access to care anywhere outside of the VA. So we're really a safety net hospital for our veterans. Unfortunately, our LA population does have high levels of substance use disorder, mental health disorders, and a lot of veterans who are experiencing homelessness. So with those challenges, we also have a lot of resources within our VA to really address those social determinants of health for our patient population. And while it can be a challenge, it's something that we really embrace here at our VA, and it's truly an honor to be able to take care of them. So this is just a breakdown of our patient population in terms of racial identity. We care for a very diverse patient population, and I will also note here that our population does skew mostly male and elderly. We do care for female veterans, especially on the outpatient side, and there are a few on the inpatient side, but just to say that if you're interested in women's health, this might not be the best fit for your intern year experience with us. That said, we see so much bread and butter medicine here at the VA, and it is truly a great clinical experience. So this is the schedule kind of breakdown for your intern year. As you can see, a lot of the time is going to be spent on medicine wards, mostly in 2-week chunks. We do have a 4+1 schedule. So every 5th week, you'll be back in clinic. And that means about 10 weeks of the year will be spent in clinic. In addition to that, during that +1 block, you have 2 half-days of neurology clinic, which I'll show you in a second. You'll also spend some time doing ambulatory subspecialty during a dedicated block there. You have some time in the ICU, on our cardiology wards. You have a little bit of time on our night float service. You have a rotation in the ER, which is a really great experience for kind of breadth of experiences. And then we've cultivated some subspecialty consult rotations that we hope are relevant for your future career going forward, where there's some overlap. You'll spend 2 weeks with our neurology service at the VA, and then you have 4 weeks of vacation that are split up in 2-week blocks. So this is what that looks like in a year mapped out. And these numbers in the rows are the weeks of the year. What I can show you is that the +1s are when you'll come back to your clinic every 5th week. And I've highlighted those golden because those are Monday through Friday weeks, where you are not expected to be here on weekends. As you'll note, the rest of the year is kind of mapped out in 2-week blocks. And whenever there is a golden block, that's another rotation where you'll be Monday through Friday and have your weekends protected. So there is kind of 2-week chunks of wards and ICU and ER kind of spread throughout. And of course, your schedule may not look exactly like this, but this is an example. And then our nights rotation is every other night. So there's a little bit of time to rest in between. This is what your +1 clinic schedule will probably look like. So we rotate on Thursdays, and then the week ends on Wednesday. So you'll have some time, half days, doing some subspecialty experiences in our various clinics. You have 2 neurology half-day clinics on Thursday and Mondays. And then Wednesday morning is our protected didactic time for our medicine residents. During that time, you have the option of attending our medicine didactics or attending the neurology didactics, which happen to happen at the same exact time. And it's really kind of a choose your own adventure because we want you to be able to choose which half day of didactics really best suit your future needs. In terms of other didactics at the VA here, we have twice a day didactics, Monday through Friday. So there's morning report, which is a much smaller kind of group discussion. We have noon conference, which is more kind of traditional lecture styles. I mentioned the +1 Wednesday morning when we have our outpatient medicine review is also when you can go to neurology didactics and grand rounds. And then our residents all participate in a quality improvement curriculum through the year. And if you are interested in that, you can also take the lead during your +1 firm to drive your QI project forward. I just wanted to spotlight VA morning report because it is truly my favorite time of day. It is a case-based conference that's led by our residents. So a resident comes, brings a case, kind of informally presents it, and a chief resident or a hospitalist helps facilitate the case discussion. Everyone is blinded to the case, so we're all adventuring together, and it's really fun to kind of practice our clinical reasoning together. And then we used to call it the attending corner because attendings love to come, but now it's kind of expanded into an attending quadrant. So there's always a good number of hospitalists, faculty who are there, who are like really excited to go through the case with everyone and also share learning pearls along the way. And if you happen to not be able to make it to morning report, because we know the day gets busy, our chief residents actually send out a morning report roundup every month where they kind of highlight a few cases and the teaching points that were shared during the discussion so that you can do a little bit of learning asynchronously. And also, if you were there, it's helpful for spaced repetition. So these are just our residents, and really it really comes down to the people. During your PGY-1 year, you'll be fully integrated with our internal medicine program. You also will spend a lot of time with our anesthesiology PGY-1s who also spend their entire year at the VA here at the West LA VA. And I think that probably the great perk is that you get to really know your future medicine co-residents and build that bond so that later when you're calling one another up for consults, whether it's to neurology or vice versa to medicine, that bond is there. And our residents really come from all walks of life. About a third of our residents come to us with additional degrees. About a third identify as being underrepresented in medicine. And our residents come from 21 different states across the US. This was last year's statistics. So we really have people from all over. And finally, a plug for our I Am Ready committee, which is our Resident Equity, Diversity, and Inclusion Committee, is really our house staff driven initiative to build a sense of community within our program, expand our involvement in the LA community, and also just make sure that we provide mentorship to the pipeline of recruiting physicians who are underrepresented in medicine. So if you're interested in learning more, of course, you can always reach out to the Neurology Education Office. My email is here if you have specific questions for me about the VA site. And if you're just curious to learn more about what that year might look like, our chief residents run an Instagram account that's pretty active. And right now they're in their recruitment phase. So they're posting day in the life of a resident every Tuesday. So feel free to join us and take a look and see what it might look like for your year. And that's all I've got. Thank you.
Great. Thank you so much, Kelley. And joining us from the VA, representing our interns is Christine. Christine, do you want to say hi?
Hi, how is everybody? Nice to meet y'all. I am here at the VA, actually. I just finished one of the afternoon neuro clinics that Dr. Chuang mentioned. And yeah, it's a really wonderful time to kind of get to know the neurology department a little bit. Jules is also there doing her thing. And yeah, so it's great to kind of meet everybody and just kind of get familiar a little bit with the neuro world. And it's nice to have that, once every 4 weeks or so. And then, like Dr. Chuang said, we also have our neurology rotation here. So it's great to kind of have that continuity in terms of learning the medicine side of things, consulting neurology, and then, eventually being here and seeing what it's like. So yeah, so happy to answer any questions, and I'll leave my email in the chat. If there are any questions right now, I'm happy to answer them.
Great. Maybe before we take questions from our applicants, we'll
Sure.
take a turn to hear from all of you about the intern experience there. And then we'll introduce our interns joining us from all of you, and then we can open things up for questions. So thank you both, but we'll switch gears now. I'll turn it over to Dr. Suthar, who will share with us about the intern year experience at all of you.
Great, thanks so much. It's nice to see everybody, and I look forward to hopefully seeing you guys over here at all of you for your intern year. Just to make sure, can you guys all see my slides? Yeah?
Yes.
Okay, excellent. Thank you, Jared. All right, so all of you sit about a 25-minute drive from Westwood campus. So we're not very far from the West LA VA. We have 95 medicine house staff here at all of you, and our neuro prelims are part of that house staff body. You are fully integrated into the categorical program during your prelim year. So you are rotating with all the medicine residents here. you're going to all the fun bonding events. You are part of us for that year. These are some pictures of some of the folks that you would be working with, and I'm going to kind of go through the hows and whys of all of you, if I can get this to work. This is obviously not me dancing, but we have a lot of fun here. We try to make things interesting, and I think more than anything, the patients here at all of you are some of the most fantastic patients that I have had the privilege to work with, and I'll tell you a little bit about who we take care of here. So I'm going to first introduce you to the house staff body that you would be working with. So like I mentioned, we have 95 medicine house staff. We have 41 interns. So we have a contingent of our categorical medicine interns. We have several prelim interns that train here from neurology, ophthalmology, and then general prelim medicine. And then we have primary care interns as well. So you'll get to work with a lot of different people. You'll also be interacting with ER interns, family medicine interns, anesthesia interns through your ER rotations, or excuse me, your ICU rotations and on the medicine wards. I have a great team I get to work with, just so that you've seen their faces. So I have 3 associate program directors, a wonderful chair of medicine here, and a great management team, and we're very excited to hopefully get to work with you. I wanted to kind of just talk about the mission of all of you. We are a safety net hospital here in Los Angeles County. So we take care of all patients, regardless of insurance status. Our goal really here is to train compassionate and clinically outstanding physicians while we provide the highest quality of care to an underserved population. So we have a pretty large catchment area within Los Angeles County. Our patients come from all over. Many of them are coming from the Central Valley and High Desert area, over from the Santa Monica Mountain region, San Gabriel Valley, all the way down really to the northern parts of Orange County. And so because we take care of a large catchment area, we have a really ethnically diverse patient population. We take care of patients that are not only from the United States, but we have a global population here. And so, as you know, Los Angeles is one of the major ports of entry for the country, and we take care of a lot of patients coming from all over the world. About 50% of our patients identify with a Hispanic or Latinx descent. The other 50% are comprised of multiple ethnic subgroups. So we have a pretty large Vietnamese population here, a large Middle Eastern population, particularly Farsi-speaking patients and Armenian-speaking patients. And then we actually have a large subset of patients that are seeking asylum in this country, and we take care of them. Our patients don't have to be able to pay for care, so they can be insured under the Medicaid system. They might be insured under Medicare, or they may be insured under state-based policies or not insured at all. So we take any patient that walks through our doors. So, you know, we have a few goals for you for your prelim year, and obviously you want these goals to marry with the goals that you have for your prelim year. You know, really our program tries to give you the biggest and broadest based educational experience in internal medicine. So you go into your neurology experience with that really solid foundation. The goal is to expose you to the 3 different hospital systems that you'll work with in the future. So you rotate not only at all of you, but you'll also go to Westwood, so Ronald Reagan, UCLA, and then you also will do some wards at the VA. So you'll get exposure to all 3. Just as Kelley mentioned, you know, one of the biggest things is the people you work with and kind of gaining that network of individuals that you know, not only in neurology, but in medicine also. So you will be rotating with the neurology consult service here at all of you, so you get to know all of your neuro colleagues here. But you'll also be interacting with so many different other trainees throughout all the subspecialties. And then, you know, one of my personal goals, and hopefully this aligns with yours, is kind of to show you the joy and the satisfaction that comes from caring from underserved and underrepresented patients. So how do we get you all set up for that broad-based education? Well, this is kind of the breakdown. It's very similar actually to your VA breakdown. Our inpatient ward units here are all combined. So we don't have like a separate cardiology ward. Everything is under general medicine here, including neurology patients. So neurology patients are admitted on our inpatient ward. So you will see neuro patients throughout your ward education, actually. We don't have like just a separate service. And then you'll also rotate on the consult service here. You'll get neurology experience also in the outpatient setting. So you'll be on a 4+1 system. So just like the VA, every 5th week, you'll come to the continuity care setting. You will see patients that you will be following in outpatient clinics, and then also rotate through all of the medical subspecialties that we can. We try to align the prelim experience to what we think will set you up for your neurology experience. So we will try to get you, cardiology clinic or rheumatology clinic, things that will overlap with your neurology experience. Of course, we give you vacation time, and then there's some other opportunities like urgent care and things of that nature. Our medicine wards are pretty standard. I just put this up here so you've seen it, but we are actually on a modified call schedule. So we have an 8-day call, call cycle here. As interns, you never spend the night here, but you will be working with a senior resident, medical students here. So usually we have 2 medical students on every service. So you'll be teaching here while you're rotating. And then just, like the VA, we have our daily noon conferences, and we have a pretty robust interdisciplinary team system here. So you'll get to really interact with utilization review individuals, nursing, physical therapy, nutritionists, who will all help you take care of your inpatients. And I think that's really important because that's going to be something you're going to be doing as a neurologist, taking care of your more complicated neurologic patients. As I mentioned, you will also rotate on the Reagan wards as well. So you'll have some quaternary care experience. You'll also get some of that experience through our ICUs. So you'll be rotating both at the Olive ICU. And here we have both an attending and a pulmonary crit fellow. You'll be part of you'll be part of a day team, and then you'll switch to a night team. Here again, you don't spend the night. This is all shift work here. Our ambulatory medicine is every 5th week. Here, you'll spend about 50% of your time doing continuity of care. So we actually have a pretty robust patient-centered medical home. In that patient-centered medical home, you have MAs, you have case managers. So there are people there to help you, to call the patient if their tests are normal, or to get them into substance use counseling, or to review their medications. So there's a lot of people within the system to help you manage your continuity patients. The other 50% of the time you'll spend in the subspecialties. So our interns do go through women's health. If that's something of interest, you'll have that opportunity. Dermatology clinic, neurology clinic, as well as the medical subspecialties. Our academic half day for our interns is on Wednesday mornings. So you have no clinical activities during that time, and it's really dedicated time for you to sink your teeth in to the bread and butter of medicine. And then we kind of go through some other kind of more nuanced things too. How do you motivate your patient to make changes? How do you run a code? How do you do all these other things that you need to do as a physician? And that's called our Professions of Medicine series. So the last thing I kind of wanted to touch upon is resident wellness. I mean, there's so many things that go into the idea of being well as a physician. Some of that is who you connect with. Do you connect with the value system of the group that you're working with? As others have mentioned, our work here at Olive really stems in the idea that it does not matter where you come from, you will get equitable care here. And so we really try, one, to recruit a very diverse workforce. We want our residents to come from all backgrounds. We honor that and the difference of opinions that come from that. And then we also want our patients to see physicians who might share, differences in backgrounds and opinions. So we really try to keep a very inclusive environment here. And I think that goes a long way in resident wellness. But obviously I have my interns here that you can ask them about that. We also give you kind of a real toolkit for how you're going to practice for the next 40 years of your life. Things like mindfulness and forgiving yourself when you make a mistake. There's a whole resiliency curriculum that we go through because there's going to be a lot of things as an intern and beyond that you may not have ever experienced. And our goal is to try to help you through those things. We do a lot of debriefing. We do fun bonding activities. And there's a lot of resources also from the mental health side in case you want to partake in those. So for more information, we have multiple websites. We have an Olive internal medicine website that I would highly encourage you to take a look at. It's got a lot of information, and there's actually orientation modules for any of our applicants. We have a brand new GME website, which is fun. It's got lots of information about living in Los Angeles, what Olive U's like. So please feel free to peruse any and all of that. I will definitely send all this information to Dr. Keener in case you would like it. And then I think she's going to go over how you would rank. For us, it would be under a preliminary medicine rank. So it would be a P2 instead of a C, like the VA. I want to wish you the best of luck in the match. I know this is a hard choice, and please, I'm happy to take any questions.
Great, thank you so much. And joining us today from all of you, we have, I think, Joyce and Jerry. If maybe each of you want to briefly introduce yourselves, you can tell us maybe where you came from in medical school and what you're enjoying so far about your intern year.
Hey, I can go first. I'm Joyce.
Great.
I'm one of the Olive U prelims. I actually grew up in East LA, but I spent time in New York and also went to school in Milwaukee and Wisconsin before coming back here to UCLA. I love working at Olive U. I think one of the saddest thing about being a prelim is not being integrated with the Olive U program anymore next year. But it's always going to be a pleasure to be able to do the consul service end of Olive U once we come back as neurology residents.
Great. And Jerry.
Hey everyone, I'm Jerry. I'm one of the neurology prelims here too. I'm originally from the Bay Area, but I went to St. Louis for undergrad and I went to Boston for medical school. I'm very happy to be back here on the West Coast. Yeah, I really enjoy how much of a team we are. Like we really are part of the All of You categorical team here, and I really could not ask for more. Like all of my colleagues are fantastic. I think we all have a great goal in common, and that philosophy really, I think, shines whenever we work with anyone from our residency, the categoricals, the family med residents, like really the whole team, and from residents down to attendings all have the same philosophy for how they practice care and why they choose to be at All of You. And I think that really shines in that program.
Great. Well, thank you both for joining us. I'll pause here and open it up to our applicants for questions. I will, as alluded to, share some slides at the end that goes over sort of in detail how to rank each of these options affiliated with our program. So I'll save those slides for the end. But if anybody would like to put a question in the chat or unmute and ask a question directly of our either our interns or our internal medicine faculty here today, now is the time. I welcome you to join.
Hey everyone, my name is Brendan. Good to meet you. I had a quick question. It's kind of vague, but what have you learned from the patients that you've taken care of at your hospital? It sounds like a really unique population. I'm just curious what you've learned from taking care of them.
Right, maybe. Well, let's toss this to the VA first. Christine, tell us what you've learned from your patients at the VA.
Oh, sure.
And maybe if you could tell us if you had a prior VA experience as a medical student.
Yeah, so I went to medical school in Loyola in Chicago, and we did have a VA there. And I actually really enjoyed working at the VA and working with veterans, and it's just been honestly, it's like such a privilege caring for veterans here now in residency. Yeah, I think sometimes the VA gets a bad rap because kind of the EMR, the electronic medical record, is a little clunky, and things can sometimes move slowly. But I think what I love about it, that Dr. Chuang alluded to, is that, the veterans here get the best care, they get the best therapies, and they don't have to worry about like insurance stuff for the most part. We're able to kind of prescribe some of the best things. I just had neurology clinic, and Walkison's is like a device that could help patients with neuropathy with gait and that sort of thing. And I can help prescribe it and help get them physical therapy with no problems. And I've really kind of learned a lot about what it's like to serve in the military, what it's like to be a veteran. I didn't know much about it. I don't come from that background. So learning from them, and just like really being so I don't know, just like proud to take care of them has just been a wonderful experience. And I would highly encourage you all to consider doing some of your training at the VA because I love it. So yeah.
Great, thanks. Joyce or Jerry, do you guys want to share what you learned from your patients at Olive?
I can go first. I think one thing that I've learned from the patients over at Olive is, I mean, this isn't necessarily specific to Olive itself or to any, or actually, let me backtrack. It's probably complicated in every setting, but I think what really sticks to me is how to navigate a healthcare system and its complexities. I think you really have to learn how to deal with that, and you work really hard with your patients in all settings to really be able to figure that out. I think things that you don't really anticipate from say like what maybe you or I would on average navigate in a healthcare system. I think that really stands out to me, and even the small logistical things of very specific portions of healthcare, like how do you get like a DME wheelchair with a cushion to someone who's gotten it stolen, for example, and how do you work to provide that for someone who really can't really navigate any of their healthcare appointments or transportation or needs without that. So just down to the small things that you get from there are things that I feel like I've had to work very closely with my patients to achieve, and to have that perform from like day one and get the ball rolling, and to see that kind of work out well. Sorry, I'm on very little sleep, unfortunately, so my words are a little bit off, but is something that's very rewarding to see that progress, I think, across that time.
That's great. Joyce, did you want to add anything?
Yeah, I think just kind of piggybacking off of what Jerry said, I think one of the unique experiences of being at Olive is working within a community health system. So in medical school, I wasn't able to work in a community hospital. I worked at a VA and worked at our like tertiary care hospital. So there were a lot of things that I didn't learn about working within a community setting until I got to Olive. And I think being able to just be there for patients who previously have been undoctored, so you were like the first point of contact for someone who has never seen a doctor before, you're taking care of them from the beginning to end. So you may have seen them in the ICU, they got downgraded to medicine, and then now you're following up with them in clinic. And to be able to see that kind of progression of where that patient is within the healthcare system actually is truly like a privilege to experience as an intern at Olive, and kind of just being able to work within a system in kind of deciding resource allocation, right? Being mindful of like what kind of tests we order for patients, that you're not like pan scanning someone. You're not ordering everything under the sun, just to kind of discover what's going on with that patient. It's actually something that you truly wouldn't really consider until you're working within like a resource limited area, right? But with that said, like you also have exposure to people who are rotating through all of the other subspecialties, and you are able to get their expertise in being able to figure out something wrong with this patient within the resources that you have. So I really love working at Olive, and I think the patients teach me something new every single day, no matter what kind of setting you're encountering them in.
Thank you, guys.
That's a great question, Brendan. Thank you. All right, it looks like we have another question here in the chat. So Rihanna asks, she says, to my understanding, there is a large Spanish-speaking patient population at all of you. Are there any tools or resources to help residents sort of navigate those interactions and enhance patient care experiences? So maybe you guys can speak to navigating maybe language barriers, and particularly the Spanish-speaking population.
Yeah, I can go really quick about this. So yes, so almost all of our patients are Spanish speaking, and I made the poor choice of trying to learn French instead of Spanish in high school, so I definitely do not speak Spanish. But good thing is that there are actually in-person interpreters at all of you, especially in the ED. So when you got assigned like a new patient to admit, you can definitely try to find one of the in-person interpreter, which makes it so much easier to kind of have a whole conversation, especially when you're trying to gather a new HMP on someone. But we also have something called Language Line Solutions. I don't know if you guys can see this, but especially has like all these different languages that are available to us that we can just dial from our phone app. And we also have iPads in the clinic settings too, with the similar app where you can also call someone up too. So there's a lot of resources to help you like be able to communicate effectively with your patient.
Great. Another very practical question. During intern year, do most residents choose housing closer to their respective intern sites, or do they choose to live like closer to the mothership in Westwood and commute? This probably is a bit of an individual preference, but why don't you guys share with us a little bit about where you chose to live this year, and what it's been like moving to Los Angeles?
I can go first in this aspect. I think so. Of the three Olive U interns, two of us live near Reagan loosely, and one of us lives up in the valley. And so it's really split kind of on personal preference. My personal preference was I wanted to be within like biking distance of a beach. So I chose to be in Santa Monica, which is a fantastic decision that I do not regret in any way, shape, or form. The commute to all of you is against traffic, and so it's about 25 to 30 minutes, usually in the morning to get there, and maybe like 30 to 35 to get back home, which really is not too bad. I find it totally navigatable. And honestly, it's easier for me to get to all of you than it is for me to get to like downtown LA. So like the drive is really not that bad.
I echo that. I also live like 5 minutes away from Jerry. It takes like 30 minutes to drive to and from, and you're always against traffic driving there. And it's actually a pretty nice drive going there and coming back too. Really enjoyable, especially when you're able to see like the sunrise and sunsets. But yeah, no, I love living here in West LA, close to Reagan and the VA, just because I know that the next 3 years are going to be primarily here, and the last thing I want to do is move again after my intern year. So it's just super convenient to be nearby here.
What about you, Christine? What has been your experience moving to Los Angeles?
Yeah, I'll just shout out the moving stipend, which is great. It's one of the benefits of UCLA. I forget how much. I think it's like $2,700, $2,600 or something like that. And part of that budget, you can actually use, I learned this after the fact, you could actually use part of that to buy a plane ticket here, lodging here, to kind of scope out the neighborhood and the areas to see if there's a spot that works better for you. So I'm a little bit different from Joyce and Jerry. I live more south. I live in Mar Vista, kind of south of Santa Monica, closer to LAX. And I live there because I live with my sister, who has to work kind of close by. And so I'm able to kind of commute there and back. Without traffic, it's like 10 minutes. With traffic, it can be like 30 minutes. But I know another one of the neuro chief residents actually lives around there as well. And, has been able to do that commute okay. That being said, I haven't like rotated at all of you yet. But yeah, I'm planning on staying here.
Great. Yeah, I think you'll find as you talk among the neurology residents that we have residents that live in a lot of different neighborhoods, mostly I think on the west side of Los Angeles. As mentioned, it's often easier to go north-south than it is to go east-west in LA in terms of traffic. But there really is, I think, something for everyone here in Los Angeles, and the commute to all of you really is not that bad at all, and is sort of against traffic if you live near UCLA. And also just to point out that the UCLA and the VA, the West LA VA campuses are extremely close to one another. They're like off the same freeway exit, just one's on the east side of the freeway, the other's on the west side of the freeway. And so they're very close to one another here. I see Joyce answering other questions in the chat about your medicine subspecialty clinic experiences. Maybe you guys could share if there's been a particular subspecialty clinic that you think has been like really educational or really interesting that you've rotated through this year.
I would say rheum by far. I had very little knowledge of rheumatology before this, and to have that experience with some very fantastic attendings. They love to teach, and you'll get to know every single niche test, like the Schwarmer test, to really figure out, like Sjogren's, for example, like teach how to really do that, and you get into like the real great details that are going to be really useful for you later on too. So I think rheum is by far one of my favorite of the clinics. And I feel like I've learned a lot going forward from having very little knowledge beforehand.
Great. Joyce, do you have a favorite subspecialty clinic?
I honestly have enjoyed rotating through all of the subspecialties, especially knowing that I'm not going to be practicing in those subspecialties in the future. So it's always nice to be able to work with all of those attendees who know so much about the specific specialty. And they also take the time to kind of teach you about each patient too, which I truly appreciate as well. But yeah, I mean, I think endo is really interesting and super fun. And Dr. McHale is our notorious endocrinologist who's fantastic at always teaching everyone, and he does all of the consults at all of you. So it's always been really, really fun to rotate through endo there.
How about you, Christine?
Yeah, I'll say two things. And I wanted to emphasize something that Dr. Chuang mentioned, which was that the VA has such great bread and butter medicine. And I'll also echo Jerry's vote for rheumatology. I was in rheumatology clinic this morning, and the attendings are amazing, and we'll kind of, they treat us like the categorical, they got to inject some knees today. So that was very satisfying. And then another favorite of mine is cardiology. The cardiologists here and the fellows are just really, really amazing, teaching us high yield things on like AFib and anticoagulation, stuff that will be very relevant to us next year. So those are my two votes.
Great, thank you for sharing. We have another question in the chat about sort of comparing teaching formats. And this might be hard because you don't have both experiences, but do residents have thoughts on the key differences and pros and cons of an academic half day versus like noon lectures, I guess? This is like an educational philosophy question. What have been some of your favorite, I would say, learning moments in internship in like the formal didactics that you guys have?
I think it's different for us at all of you because during our ambulatory week, for our like Wednesday morning didactic, it's done during in our small group. So it's done with our podcast or pod, who is all the interns who are doing the ambulatory week at the same time as you are. And it's small group format for the entire half day. So we're not able to join the neurology half day, which is unfortunate, but at the same time, like we're going to be doing neuro for like the next 3+ years. So I think it's really important that we are able to participate in like the IAM small group didactics, and also during like our noon conferences that occur daily as well.
I guess the pro cons are like the volume and integration of knowledge. Like with an academic half day, you can really tie together a lot of concepts in one, like diabetes management and like diabetes medication and so on and so forth. But then you also get like a ton of information, at once. So it's good because you can really integrate a lot of, I think, specific topics in a particular half day. but you also learn via the classic fire hose. And so how much of that can you actually absorb during that day is tough. Whereas noon conference, you can get like a pretty high yield specific time where you can sit down. But I also echo Joyce in terms of the academic half day. You're able to kind of see people you haven't seen in like a month or so with the same group of people every ambulatory block. And so that's really nice to kind of catch up with that small group of like 5 or 6 people.
I will say it sounds like we have very similar academic models between all of you and VA. Like we have the same kind of intern morning reports. We also, I had not mentioned, but we have a weekly intern intake that happens every Tuesday during noon conference. So the interns are specifically like excused to go to that lecture and the residents carry the pager. So I think we have pretty much the same exact didactics offered in the same methods.
Yeah, I was going to say the same thing. Actually, it's all the same offerings, just in different permutations or days.
Exactly.
I'll pose a question if we don't have any other questions from our applicants. I wanted to ask if you guys at the VA and all of you ever get to see each other or hang out as a class of interns.
We were just over at Jerry's place, actually.
Is this why you're all on such little sleep?
No. Yeah, we also what was it, Jerry? A couple weekends ago, we went to do trivia night together. Oh, Joyce is showing our picture of all of us hanging out with our significant others as well. And we did a trivia night, which, you know, one of the questions was, what does a cabbage stand for? And we were like, we got this. But yeah, anyways, hoping to spend some more time together, but obviously our schedules are really busy. I want to shout out Jerry and Joyce because they're taking step 3 right now. So thank you so much for joining. But we still are making time for each other. So it's great.
Yeah, this just for a little context, this is the first year that we have all 9 of our interns here in Los Angeles. So we just sort of switched formats and began having categorical interns a couple of years ago. And it started with just 3 categorical interns, and it has sort of gradually grown. And so this is actually the first year that we have 6 categorical interns and 3 spots at all of you. And so it's been great to have all 9 of our interns sort of in Los Angeles, getting to know one another, getting to know our residents as they interact on their rotations. Yeah, so just wanted to plant that question to sort of highlight that even though you're in separate programs, you will get to see each other. You will be rotating and interacting with one another. And so I just wanted to highlight that as well. We're all friends, guys. I love that. Good. Well, if there aren't any other questions from our applicants, I'm going to share my slides to answer what usually is one of the biggest questions about how do we actually put this in the NRMP rank list. And so I'm going to go ahead and share my slides and take you through sort of the logistics of ranking UCLA Neurology. All right. So let's see. Can you see, what can you see? This is not going into presentation mode. Okay. Which one can you see?
We can see all the slides.
Okay.
Not quite in
Swap.
presentation mode
Swap.
yet.
Okay, that's not what we want. Let's try this again. All right, can we see intern year options? I have too many things open. Yes?
We can see that slide.
Yes, we could see it too.
Okay. I'm just gonna leave it like this and not try to share it. Okay. All right, great. So well, now I've really messed up. Okay. So, so we reviewed the two main options today. So we have our UCLA Neurology categorical program, which is 6 positions where you will spend your intern year based at the West Los Angeles VA. The NRMP program code is listed here with the C in it for categorical. And then we also have the advanced neurology program with 3 positions. And the program code there has the letter A in it for advanced. With other advanced neurology residency programs you may be applying to, you will then have an option to attach a supplemental rank list where you will list your prelim program preferences. And for the All-of-You program, you will see there is a very specific code for the Medicine-Neurology prelim program at All-of-You, with that P near the end, P2 for prelim. So these are the program codes for ranking our program. This is what it looks like in the system. So when your rank list opens, you will log into this system. You will scroll down and click Find and Add Program, where you can add these by program number. You can also search by name to find the program and then add those to your list. These screenshots are all on the website, and we'll walk you through in great detail sort of how to do this. So don't worry, this isn't your only chance to see these pictures. So once you find the program you're looking for, you are going to add it to your rank list and save it and go on to the next. So having these numbers will help make it easier than just searching by name for our program. But what I want to say is that if you want to come to UCLA Neurology, which hopefully you all do, then you will rank both of these options in the order of your preference. So if you want to do your internship at the West LA VA as part of our categorical residency program, you'll enter the categorical program number 1 on your rank list, and then you'll enter the advanced program number 2 on your rank list with the All-of-You program in your supplemental rank list. If you want to do internship at All-of-You, then you would do that vice versa. So rank our advanced program number 1 on your rank list and rank our categorical program number 2 on your rank list. So I just want to emphasize that if you only rank one of these options, you will risk not matching with us at UCLA Neurology. So please rank all 9 positions in whatever order is your preference for internship. But both of these intern programs provide you a great foundational experience in internal medicine. I think you'll find it very rewarding caring for the patient populations that are served at both of these hospitals. You'll continue to run into your colleagues in internal medicine in both the UCLA and All-of-You programs moving forward in residency. And I think the relationships that you form during your intern year are really valuable. I myself did my intern year at All-of-You. There was no VA option back then. I now, as an attending, spend part of my time at the VA, and I really do appreciate, I think, all that both systems of care and both communities have to offer our trainees for their education and growth. So hopefully this webinar has helped to answer some of your questions about the internship program. I will share the contact information that was shared with you through these slides today, along with that final slide set with the nitty-gritty details about how to rank our program with all of you. There will also be a copy of this recording that will be shared for those of you who are watching asynchronously. Hope you enjoy viewing. And I want to thank our interns for taking some time to be with us this evening, as well as Dr. Suthar and Dr. Chuang. Any final words of wisdom for our applicants? No, it's an exciting time. Best of luck in the match. All right. Thanks, everyone.
Thanks, everyone. Good luck.